Welcome to the PD Pet Care Vlogs. I'm Dr. Cath Watson, and today we're going to talk about Cushing's disease in dogs. So Cushing's disease is otherwise known as hyperadrenocorticism. So essentially the adrenal glands are producing too much hormone, and in particular cortisol. So while Cushing's disease is the adrenal glands producing too much hormone, there's actually two ways that can, well in fact there's three ways that can happen. First of all, it can be a tumour in the adrenal glands. That's probably a lot less common than the other forms, but is certainly one possibility. So a tumour that's actually producing too much hormone directly. The second possibility is actually that it's a tumour in the pituitary gland. So this is a really small little gland that sits at the base of your brain and sends out messages to other hormone producing organs, and in particular the adrenal glands, and tells them to produce hormone based on other factors in the body. So in the case of Cushing's disease, the pituitary gland is then producing a different hormone which triggers the adrenal glands to actually produce too much hormone as well, so the cortisol hormone. Those pituitary gland tumours often really small, and the tumour itself won't actually cause any physical problems with the functioning of the brain, other than signalling to the adrenal glands that they should be producing too much hormone. And then the third way that we'll see Cushing's disease develop in dogs is called iatrogenic, which basically means that we are causing it by something we're doing, and in this case it's giving them medication. It's usually long-term medications, and particularly steroids, so corticosteroids that are commonly given to dogs for a variety of reasons, but particularly skin conditions, and in some cases for cancers as well. So the symptoms of Cushing's disease, very similar to sugar diabetes. Basically they drink a lot of water, they pee a lot as a result, often can't hold on through the night. And when we're talking a lot of water, for most dogs it is literally bucket loads of water, they can't get enough. They're usually really hungry and will go scavenging, and this may be a dog who's not been hungry in the past. They'll often develop a really potty tummy, and part of that's because they essentially end up with weaker muscles, so those tummy muscles end up stretched a bit, and they're also putting more fat deposition in the abdomen, and the liver tends to get a bit bigger as well. There's often some skin changes, they're really prone to skin infections. If it's been going on for a while, sometimes they can get little calcium nodules on the back of their neck, and they'll often end up with quite flaky skin, often really greasy as well. Mentioned muscle weakness, but also more prone to other infections like urinary tract infections as well. So Cushing's disease is normally diagnosed with a combination of the symptoms that they're showing, routine blood tests, so looking at blood chemistry factors like liver enzymes, cholesterol levels and so on, and then some specialist blood tests as well, so low dose dexamethasone suppression test or an ACTH stimulation test, which is aiming to get a response from the body, or lack of response in the case of Cushing's disease where it's not suppressing cortisol levels. And sometimes we need to do things like ultrasound as well just to back that up. So unfortunately, sometimes the disease is very clear cut, it's very obvious what the diagnosis is of the combination of symptoms and blood tests. Sometimes it's not as obvious as we'd like, and there may be other tests done as well. As far as how it's treated, if we're talking adrenal gland tumours, which as I said at the start are not actually that common, then surgery is a possibility to actually remove the adrenal gland that's affected by the tumour. It's a pretty gnarly sort of surgery. It's usually something that would be referred to a specialist to do because it's high risk. So not normally something that's available in most cases in general practice. Most cases that we would see and treat would be pituitary caused, so that's that wee tumour at the base of the brain. Much more difficult area to access, so surgery is pretty uncommon for that, and again because the tumour itself is quite little and doesn't cause any problems, usually what we do is treat it medically. So there are a series of options. The most common one used these days is called trilostane, or Vetoral would be the brand name. And that is an ongoing medication that they're usually getting every day for the rest of their lives, that's helping block the production of all that excess hormone. So it reduces the clinical signs essentially. It's not actually stopping the disease process that's going on underneath. So the tumour's still there, it's just that this particular drug's stopping the effect of those hormones on the body. So that's the most common treatment. It can be quite costly over time to treat Cushing's disease, particularly as there are some side effects that we need to monitor for. So the risk of treating Cushing's disease is that you can end up causing the opposite, which is called Addison's disease, where there's not enough cortisol in the body, and that can happen at any point during treatment as well. So that's something we routinely blood test for to monitor underlying issues as well. Obviously, if it's been iatrogenically caused, so from medications that the dog's been given, then it's a case of withdrawing those medications to try and reverse the effects of the excess that's ended up building up in the body. That needs to be done pretty carefully over time, but usually you can then reverse the symptoms long term. In some cases, people choose not to treat Cushing's disease. And look, that's okay as long as you can manage the symptoms. And for most people, it's the peeing everywhere and the constant thirst that's the biggest issue to deal with. Cushing's disease in itself is not likely to cause death. It's usually the other stuff that comes along with it. So the infections, the weakness, and like I say, being unable to manage the clinical signs that go with it, that excessive thirst and excessive drinking. So it is okay to not treat as long as their quality of life is okay and you can manage those symptoms. But if you do treat, they normally have a very good quality of life and go on to live a normal life. And like I say, it's not the Cushing's disease that's going to result in their ultimate demise. So it's a relatively common disease out there that, like I say, can be a little awkward sometimes to diagnose, but can be pretty straightforward to treat, but can be costly. Good reason to have pet insurance.